10 Best Foods for an Enlarged Prostate. Benign prostatic hyperplasia, BPH, a benign illness that results in frequent urination, a stop-start urine flow, and pain during urination, affects half of men over the age of 60. Prostate cancer, which affects about 1 in 8 men at some point in their life, and prostatitis, a bacterial infection that produces brief pain and discomfort, are additional illnesses that can affect the prostate. Poor food and lifestyle choices have been associated with all 3 illnesses, though not only. To help your prostate stay healthier, try including these 10 foods in your weekly diet. The information on the Fine Health channel is offered solely for general and educational reasons and does not replace professional medical guidance or treatment. For any ailments or medical concerns you may have, please get advice from a physician. Peppers. The nutritional compositions of peppers vary slightly amongst varieties, with more vitamin C than any other food. Yes, including oranges, bell peppers may help lessen the swelling and irritation that come with an enlarged prostate. Additionally, vitamin C has a diuretic effect, which some men claim makes urinating better. High-dose intravenous vitamin C administration has been demonstrated to shrink prostate cancer tumors and may be just as successful in treating infections as antibiotics. The compound that gives peppers their heat, capsaicin, is found in greater concentrations in jalapeno peppers. According to research conducted in laboratories, capsaicin causes cancer cells to commit suicide. 80% of cancer cells were shown to die when exposed to capsaicin. To experience these advantages, you would have to consume up to 8 peppers a week, which is impractical. As the medical profession works to incorporate capsaicin into future medications, for the time being, keep your prostate healthy by including a variety of peppers in your weekly diet. Tomatoes. Lycopene, a potent antioxidant carotenoid linked to lowered blood levels of antigen, a protein linked to prostate inflammation, and BPH is responsible for tomatoes' striking red color. Eating 2 servings of tomato sauce per week decreased the incidence of prostate cancer by 23% compared to men who rarely ate tomato-based products, according to a Harvard University study involving 47,894 men. A different study found that taking 15 mg of lycopene every day slowed the advancement of BPH. Purees and pasta sauces made with cooked or processed tomatoes are the finest sources of lycopene because fresh tomatoes are difficult for the body to digest. This is because heating disintegrates cell membranes and increases the bioavailability of lycopene. But beware of sauces that contain added sugar. Garlic. Alliums are chemicals that are protective found in garlic, onions, and leeks. Particularly, garlic has long been used medicinally to treat a variety of ailments, from low immune function to high blood pressure. More recently, research has demonstrated that eating a lot of garlic helps lower the incidence of BPH and treat urinary tract infections, which are frequently brought on by an enlarged prostate. Men who regularly ate garlic had a 28% lower risk of BPH than men who never ate garlic, according to a study examining the diets of 2,820 males. In contrast to men who ate little garlic, men who consumed at least 10 grams of foods high in alliums per day saw a halving of their risk of prostate cancer, according to a different population-based study conducted in China. However, other studies have found little protective effect against cancer. Cruciferous vegetables. A higher consumption of cruciferous vegetables seems to be associated with a lower risk of prostate cancer. Sulforaphane, a substance found in cruciferous vegetables, including broccoli, cauliflower, cabbage, and kale, appears to target and kill cancer cells while sparing healthy ones. It's been called the greatest phytochemical inducer of phase 2 enzymes, which may lower the risk of prostate cancer and aid in the battle against carcinogens. The greatest natural source of sulforaphane is broccoli, and studies have shown that eating broccoli and tomatoes combined can reduce tumor size more effectively than eating either vegetable alone. When these are taken together, Their many anti-cancer pathways produce a cumulative impact. Pumpkin seeds. One of the best food sources of zinc is pumpkin seeds, which is beneficial because 75% of men with enlarged prostates have low zinc levels. Men require higher levels of zinc than women because they lose zinc with every seminal discharge. Deficiency frequently leads to an enlarged and irritated prostate. According to studies, men with prostatitis frequently have zinc levels 90% lower than those of healthy prostates. In 70% of cases, reducing zinc intake to 100 mg per day substantially reduced enlarged prostate size and relieved symptoms. Nuts. A tiny handful of nuts is among the greatest snacks you can have, particularly rich in vitamin E and selenium. Brazil nuts have earned the moniker superfood against cancer. Selenium increases testosterone levels, enhances sperm quality and motility, and fortifies the immune system against infections, while vitamin E keeps healthy cell membranes. A daily selenium consumption lowered the incidence of lung cancer by 46%, colon cancer by 58%, and prostate cancer by 63%, according to a 5-year study. You can get enough vitamins and minerals from just 2 to 4 raw nuts every day to keep your prostate healthy. Cooking them ruins their delicate mineral and vitamin content, so avoid doing that. Soya-based foods. Many Asian countries, which remarkably also have lower rates of prostate cancer than Western countries where soya intake is low, are known for their staple foods, which include tofu, tempeh, soya milk, and edamame beans. The isoflavones genistein and digoxin, which function similarly to the hormone estrogen, are only found in soy. According to studies conducted in laboratories, genistein in particular may be able to cause cancer cells to die and improve the radiation's effect on cancer cells. Studies on populations have also shown a connection between low incidence of prostate cancer and increased soy intake. 1 month's worth of eating 2 ounces of soya can result in a 13% decrease in prostate-specific antigen, PSA levels, which are frequently used as a screening tool for prostate cancer. But there are benefits and drawbacks to eating a lot of soy. Apart from the aforementioned advantages, soy consumption should be limited as it may lead to changes in hormone levels. Oily fish. Omega-3 fatty acids are abundant in oily freshwater fish, including trout, herring, sardines, mackerel, and salmon. These fatty acids have been demonstrated to have anti-inflammatory properties. In addition to suggesting that insufficiency may be a contributing cause to prostate problems, a recent study indicated that diets high in omega-3 aided to reduce the growth and spread of prostate cancer cells. Omega-3 and 6 fatty acid levels are unbalanced in the average Western diet. Pro-inflammatory omega-6 fatty acids, like those in vegetable oil, are necessary to shield the body against harm and illness, but excessive amounts of them can also be harmful. To counteract these effects, we require additional omega-3 anti-inflammatory fatty acids. To get adequate amounts of omega-3, try to eat 2 servings of fish per week, one of which should be oily. Saw palmetto. The North American shrub known as saw palmetto, which resembles a palm, has long been used to treat BPH. It yields a fruit that is high in phytosterols and fatty acids, which are thought to lessen the body's conversion of testosterone to DHT and relieve symptoms of an enlarged prostate, like the need to urinate often. Just simmer 1 teaspoon of the blackberries in 5 minutes of hot water and then drink twice a day. As an alternative, some men discover that saw palmetto supplements offer a more convenient and affordable way to take a regular dosage. Green tea. The antioxidant chemical family known as catechins is abundant in green tea. According to one study, men with BPH who took 500 mg of green tea daily for 6 weeks saw improvements in their quality of life, reduced inflammation, and improved urine flow. According to a different study, consuming more than 5 cups of green tea per day may lower the risk of prostate cancer by lowering IGF-1, insulin-like growth factor 1, levels. To release the beneficial components found in green tea leaves. Steep them for a minimum of 5 minutes. In addition, an increasing body of research supports the use of an anti-inflammatory diet to prevent and treat prostate issues. Eating a lot of fresh fruits, vegetables, spices, and healthy fats like those in nuts, avocados, and fresh seafood is part of this diet, which is similar to the Mediterranean diet. A number of illnesses, such as heart disease, several forms of arthritis, dementia, and 20% of malignancies are associated with inflammation in the body. The anti-inflammatory diet is still in its infancy, and the study is not yet conclusive, but it appears to be beneficial. Nonetheless, there's no denying that nutrition is crucial for maintaining a healthy prostate. Many men find relief from an enlarged or inflamed prostate through a combination of lifestyle and dietary changes and supplements for prostate health. Thank you for watching. Subscribe to our channel and hit the bell icon for more informative videos.